Hi there, welcome to our pharmacy revision series by CBH Education. Today we're going to be talking about methotrexate. So methotrexate is used for neoplastic conditions such as acute leukemia, or commonly as you see rheumatoid arthritis. Mechanism of action is an inhibitor of dihydrofolate reductase. Common side effects are respiratory disorders and oral disorders, and more side effects can be found in the BNF. Key drug interactions, which you will tend to find in primary care, is the co-prescribing of trimethoprim or NSAIDs. Some of the key monitoring is that patients have to have a full blood count, renal and liver function tests every 1 to 2 weeks. And then obviously once they're stable, the monitoring has to be every 3 months. Now, one of the things with methotrexate, if you're a pharmacist working in GP practices, you've got to make sure that patients do have this monitoring done. And over COVID, some requirements have been relaxed, but it's really, really fundamentally important that this is a check that's done and systems are in place as well, which most GP practices will have. Now, from a revision perspective, in ideas you may come across in clinical practice, it's a DMARD drug. We've talked about the monitoring, and generally, if you're in a community setting as well, it's worth asking the patients whether they get their bloods done. And obviously, while making this video, we do have a shortage of blood tests for tubes, but the methotrexate ones in most areas are being prioritized as a key drug that requires monitoring. You need to make sure that you dispense the correct strength as well. Now, various audits have been done across CCGs, across community pharmacies. For rheumatoid arthritis, it's got to be 2.5 mg and have a once weekly dose. For those who have the neoplastic conditions, then obviously the 10 milligram dose will be given. And obviously, it's worth asking the patient what they're using it for as well if you are unsure. You've got to look at things such as toxicity. So patients need to be counselled on the sore throat, bruising and mouth ulcers, liver toxicity, nausea and vomiting, which is a key side effect, abdominal discomfort and dark urine, and then the respiratory effects such as shortness of breath. Folic acid must also be co-prescribed and not taken on the same day as methotrexate. This is to reduce the mucosal and gastrointestinal side effects as well. Now, obviously, methotrexate is one of those key drugs which you need to make sure that you understand that the patient's on it, why they're on it as well, and really counselling the patient on the side effects as well. Also, you need to make sure that when methotrexate is initiated by the specialist and transferred into primary care, especially for those working in GP surgeries, that shared care agreement is there as well. Thank you very much for listening to this presentation. For further revision videos on the different types of drugs and pharmacy issues, please follow us on our Facebook, Instagram, and YouTube channel. Thank you very much for listening.